This conference will now be recorded.
Good afternoon, everybody. Thanks for joining me for Allscripts training today. I really appreciate it. As a rundown of what we're going to talk about today, we're going to kind of go over a brief overview of the importance of all the things we learned in the sign-off screen yesterday, and just do a little bit of a recap for there. We're going to go over our goals of documentation, and then we're going to go over a recheck visit, a follow-up visit once we've gone now through the workflow for our new patients. What does it look like once we see the patient back in the office, and what are some efficiencies we can deploy in order to streamline our documentation, yet still create a great note? So we're going to go over that today. So I am going to open up our Pro Suite here and log into the cloud. Click on our Mountain folder, launch our clinical module, and then we will start connecting to our application. When this launches, we're going to sign into our green screen. That's logging in to our Allscripts application directly. Looks like it's stinking really hard this afternoon. Must be something in the water. Don't tell the computer it's only Wednesday. Let's see what we can do to relaunch that clinical module here and see if we can get logged in faster. So while we're waiting for the computer, we went through a lot of information yesterday. And so I want to make sure that we feel comfortable with where we are. Bear with me here. I want everyone to feel really comfortable with where we are in our learning process and how to sign off on our screen. It's imperative that we do that correctly so that we can assure that we can bill for all of our items. I'm going to put you guys on hold really quick while I get logged in. Sorry about that. Technical difficulty here. Looks like it's running fine now. Thank you for your patience. Sorry about that. So it's imperative that we know what we're doing in the billing screen and that sign-off screen so that we can make sure that we are sending over the proper documentation and information over to our billing team so that we can make sure that we get paid for what we do. We did go through this workflow in a whirlwind yesterday, so I'm just going to briefly go over this so that we can see it again, and so we can feel comfortable with that workflow. So I'm here at our encounter selection screen. I'm going to choose yesterday's encounter and click OK. I'm going to go to our history and physical screen here. And although we don't have anything populated on this encounter, I do again want to go over that sign-off screen. This is where we are going to close out our encounter. And like we talked about before yesterday, we went through our encounter types, what all of these mean. It's important to verify whether we're choosing a billable or non-billable visit. If we choose a non-billable visit, then when we click OK, none of the billing details are going to push over to billing. If it says billing or if it says billable, that's going to give us the identifier that it's going to send the information over to our billing department so that they can send our bills out to the insurance companies. So here we are on our office visit. We're going to choose our level of billing services here. Down in our billing details, this is where our assessment and plan turns to charges. And as a reminder, if it has a green dollar bill sign, then that means it's going to be billable. If it's a grayed out dollar icon, then that means it's not going to be billable. As a reminder, we want to bill for the things that we do in that date of service or that service date. But if we're just ordering it, then we would make sure that it is gray. So it's something to look at, feel comfortable with in those billing details. It's important that we do review the billing details each time. It will get faster as we get used to looking at it and what it means. But we do want to make sure we go through those billing details, make sure that we're pushing over the information to billing that we need to bill for. Once we sign off on this encounter, the only way to add a charge is to work with some workflow with your billing department of how they want to see that. We either will have to send a note to them in the messaging, the Allscripts messaging system. We'll have to send them an email. Maybe they want a form filled out. However that is, you'll have to work with your billing department to capture those missing charges if we don't capture them here in our sign-off screen. So be aware of that and start having that conversation with your billing team now of how they want that to look. On our right side, we have our print packs. Our print packs are listed here. We talked through this with our patient education, our thank you note, our physical therapy order, our OT order. Our diagnostic imaging order is what's populated when we order an MRI, CT, DEXA scan, ultrasound if it's not done in the office. Our surgery order, labs, and then we have our notes that we could populate. The example that we gave yesterday was that Epic Pass that people wanted a note for to see if they could get a refund, right? And so when we were done with this screen and we were satisfied with what it represents, we've identified which print packs we need to populate, we would click OK, and then we would start running through our print packs. And our print packs are what generate those documents that we went through. We're going to go over those documents again in our document training. So stay tuned for that. We'll have a refresher of what that looks like. But as a reminder, we can use those print pack views to add additional memorized phrases without character limits so that we can use our memorized phrases, add any additional information that we want to populate in those notes if we're hitting the character limit in our assessment and plan documentation. So again, we're going to click OK out of here in normal circumstances. I'm going to click cancel and go back to our patient face sheet. This is what we're used to seeing when we open up our patient's chart. This is our first view. Up here in our top right column, we have our patient chart. If you recall, this is going to be all of the documents that we have, all the scanned documents that we would find in a patient's chart. If I maximize this so that I can see the whole thing, all of the documents that we created in our print packs yesterday are populated here in our attached documents. So we went through this very quickly at the end of yesterday's session, but want to make sure that we revisit this. We have our diagnostic imaging. This was our MRI order. We have our physical therapy and our OT orders that have populated. These are the documents that generated out of those print packs. We have our surgery order here, our office correspondence, which was that Epic Pass letter that we wrote for the patient. We have our orders here, our lab our lab orders that we would and print and send or fax to the lab. We have our patient correspondence, which is that thank you letter that's going to generate and send to the patient's referring provider. And then we have any patient education that we populated through the system to be reflected in the patient's chart, meeting that MIPS requirement there. So that's where we're going to find them. If we want to see what they look like, we could double click on them. It will then launch our view here, and we could see what our document looks like. Now we can't edit it once it's in here. This is just a viewer. And so if we wanted to make any changes, we would have to create an addendum. And so we will talk more about the addendums in future training, how to do that, what those look like. But just so you know, we once they're queued, they've gone through our print pack process. We've clicked OK out of that print pack view screen that we went through yesterday. These are locked in. We cannot edit them from this view screen. Then we could also toggle to some of those different views of the things that we ordered, those documents here. If we wanted to take a look at those, we could print them from here. We'll go through our faxing process in a different workflow that is specific to our faxing interface and some of the enhancements we can leverage in our workflow through that. But we could fax it through here. We could save it. We could send it to the patient's portal. If the patient was participating in the patient portal, we could send it from here as well. So just some things to be aware of when we're looking at this. So I'm going to exit out of this screen. It'll take me back to my maximized view here of the chart. I'm going to click my minimize button in the top right corner. It's going to take me back to my face sheet view here. So we went to history and physical at the very beginning, and we saw that we didn't have anything in this chart except for that pre-populated HPI opening sentence that we have listed here. I want to show us what it looks like for a follow-up visit. We've done all the hard work on our first visit, we went through our workflow, our intake. How can we now use that information to enhance our workflow, expedite our documentation, and yet still get a good quality note meeting the expectations that we have for our documentation? Our documentation goals are threefold. Number one, we want to make sure that we're documenting and getting paid for all of the things that we do so that we can get paid for it, right? So we need to make sure that our documentation is accurate so that we can get paid for what we do. Number two, we need to meet the MIPS requirements. And we need to meet the MIPS requirements so that we can assure that we are able to attain the incentives versus being assessed penalties from Medicare of the requirements that they have in our participation of MIPS. And that comes a lot through clicking and documentation, unfortunately, but that is the way that it's recorded. That is our backup and support to make sure that we can attest to compliance with the MIPS program with Medicare. And then the third thing is that we need to create a defendable note. We need to be able to show our thought process, make sure that what we did is accurately recorded so that patients, referring physicians, other providers, other staff members, attorneys, whatever it is, whoever is looking at our documentation can follow along our thought pattern. And so those are going to be the three things that we come back to in all of our workflow to make sure that we're hitting those three goals. So are we meeting our MIPS requirements, compliance documents? Are we creating a defendable note? And then are we making sure we're documenting what we're doing so that we can get paid for it? So here again in our history and physical screen, we don't have any documentation. So if this was if it's an established patient coming back, new encounter, we're going to go to our clipboard with our lightning bolt on it. We're going to click that. Here in this visit template screen, this should be familiar to you for those of you who are building your physical exam templates. As a reminder, the top portion are your templates that you've created for any patient. You could pull any of these templates for any patient. So we were using that workflow for our new patients to say, I have a rotator cuff tear. I want to apply my rotator cuff template, and then we could populate it here. Down in the bottom left column here, this is the stuff, these are the documents, the templates that we've filled out previously specifically for this patient. So if we've never seen this patient before, this encounter screen is going to be empty. But if we've seen the patient before, we're going to see the history that we have. The one that we signed off yesterday is this 413 visit. And so if this is a recheck from the patient's rotator cuff tear, I can click on that template. I can go through and see that I've done my history and present illness. My history is available. We have my review of systems, our physical exam, and our assessment and plan. It's already populated from all the work that I did before. And I have the ability to pull this forward into my new encounter. And so I can choose that date of service that is most appropriate and most like that I want to record for this visit. I can click on that, have it come up in my preview screen here. I can decide that I want to add the history if I want. If I do that, then you'll see that the text goes from gray. You'll see that it's grayed out here. Then if I choose the history button, it then turns the text to black, and the black text indicates that it's going to be included in my document. If I go through here and think, I really do, I need the allergies, medication, problem list, but I don't necessarily need the past surgical history in there. Again, I don't need the flu information. We've already been through the social history and the family history. I just really want these, the last pieces that I need to be included in my template. We can absolutely do that and pick and choose which pieces are then pulled through into our new document. Physicians and staff, have conversations together amongst your team of what you want this to look like. This is our opportunity to bring it forward, and so we need to make sure that everybody's on the same page in the clinics of what we want included and what we want excluded as we document our follow-up items. We have one chance to pull it forward, and so we want to make sure that we have the accurate information. If we pull it forward and we don't want it included, then we have to go through and delete it with that trash can button in our templates. So keep that in mind. Have a conversation and agree before you launch into your go live of what you want your documentation to look like. So here we are. We have decided the items that we want in our history. We have our review of systems, our physical exam, and then our diagnosis that's going to pull through. I'm going to click OK. When I do that, you'll see that our history in physical form is going to populate. This is the view of our note now. And it pulled in the work that I did from the last encounter and pulled it into this view. So, and in here, I'm going to go and go into my history and present illness. I can click on my HPI. I'm going to change my exam. Here, I'm going to see the shoulder again. I'm going to check that recheck yes button. Click OK. You'll see our term changes. That a 40-year-old female who presents for a follow-up for shoulder problem. If we click shoulder problem, it's going to populate that dynamic HPI that we already filled out. We're going to make sure that it gives us any updated information that we receive from the patient, maybe the past treatment we've given them, some additional medication that we put them on a medication program, and we want to make sure that we document that that's working. We can make those updates in our dynamic HPI, and then you'll see that it adds that information to our HPI. The notes that we previously made for the HPI for our physician are also going to pull forward, so we can change those as appropriate. And then we can click OK. It's going to update and then take us back to our history and physical screen. And you can certainly go through this and use this as your workflow. We have our HPI. We're going to go through our allergies, verify that those are the same. We're going to reconcile those. Click OK. Come back to our medication. Verify that all of these medications are still active with the patient. Click reconcile. Click OK. And you'll see that we're adding that to our note here. We have our past problem list. We're going to verify that with the patient. We're going to reconcile that, showing that we looked at it, verified it with the patient, and then it will also record that. Our review of systems, we could work directly from here. The patient presented with a cough in our last visit, but that has since been resolved. So then we can come and change that to negative, and then take off the exclamation, showing that it's not present. Click OK, and then you'll see that it changes on the review of system here. We can do the same thing for our physical exam. We can go through, change any of the information that we have listed here. We could change range of motion. Click OK, and we'll update that on our note. Our assessment and plan gives us our diagnosis, and we can hit mark as reviewed if that's still the accurate diagnosis that we have. Doing it this way does not change that we need to go into our assessment and plan, and then we need to go through our short list and go through and add all the items that we complete at our follow-up visit. We still need to go in and add our x-rays, add our injection, if we did that, add our medications that we injected. It's not going to pull that information for us into the new note, but it does give us the opportunity to do for our patient intake portion of it and our physical exam. It allows us to bring that information forward. So as we look at our note, we do want to make sure, I want to call a couple of things out about pulling forward a note. Number one is like we talked about before, we want to create a defendable note. We want to make sure that we can identify and follow the medical decision making and thought process of our clinicians in our document. And so it does need to be unique. We need to make sure that we're not just pulling forward from the last visit, applying and moving on. It does need to have some specific information and thought process about what we did specifically in that visit. It's part of the level 1 criteria that COPIC, our malpractice carrier, comes in and reviews our charts every other year. It's one of their level 1 criteria, meaning that it is a requirement of theirs that we don't just pull forward and drop in a template without making specific modifications. So be thoughtful in your documentation process. But also look for ways to leverage your memorized phrases and some of the workflows that we have built in already to enhance our follow-up patients, our post-op patients. When we did our physical exam training, we talked about deciding whether it was going to be most advantageous for us by individual to say, I'm going to use templates for all of my new patients, or I'm going to use the pencil and I'm going to dictate all of my new patient notes, right? Or maybe we look at creating some memorized phrases for our post-ops. And maybe we do that for our 10-day, our 4-week, and our 8-week post-ops, and we could drop those in. It's going to be different for everybody, and so I want everyone to think through that and see how we can leverage some of the tools that Allscripts has built in to help create those workflows and make those easier for us. Real quick, I'm going to show you, before we get to our questions, I'm going to show you again how we dropped that screen, how we dropped in the previous template. I'm going to pull up my patient here. I'm going to open a new encounter so we don't have anything on our history and physical. I'm going to go to our history and physical. You can see that that is blank. I'm going to go to our clipboard with our lightning bolt. I'm going to choose a previous encounter, verify the things that I want to pull down here. I'm not going to see the patient for their knee, so I'm going to take their HPI for their knee out. I'm going to make sure that we don't have anything of our assessment and plan listed outside of our diagnosis. There, click OK, and then it will populate our HPI, our history and physical, which is our patient note listed here. And then we could go through and make the edits. After we've addressed a line here or a subcategory, it will go from gray to white, and then you'll see that it changed from mark as reviewed to that piece disappears, and then it turns white because we've already looked at that in our workflow. Some of the things that are not included if we choose to do our workflow from our history and physical screen, vitals are not included in our workflow, so we would have to go in through there and make sure that we add our vitals for today. The other piece is our demographics and going into the pencil, other information, and verifying that pharmacy with the patient so that we can assure that we can e-prescribe and then use EPCS, which is e-prescribing for scheduled medications. And we want to make sure that we have that built in so that if we need to send a prescription, we can do that. So those are some of the pieces that are not included in our history and physical screen, yet we would still need to make sure that we follow that workflow. So we're ending our time for our training today. We have one question. I'm going to answer that one for us. And the other thing that I want you guys to know before we wind down is that tomorrow we're going to be talking about patient messaging. And so how do we message in the system? How do we, if a patient calls, how do we document that? How do we send a message to our providers? How do we respond back to our clinic staff to make sure that we have fluid communication? And then how do we make sure that that documentation, that back and forth gets charted into the patient's chart so that we have documentation of that conversation and the decisions that were made, like a telephone call template, for those of you who are familiar with that term. So we're going to go over that tomorrow, so join me for that tomorrow. The question that we have in our chat, are the MAs going to reconcile our past medical history and review of systems? And the answer is that is the expectation, is that in the workflow that our medical assistants, our clinic staff, instead of coming through here for our follow-up patients, going through our reason for visit, vitals, history, review of systems, instead of going through each of these lines, that we're able to reconcile them from our history and physical. We could also do them through our screen here if we wanted to do them that way as well. If we were going to our allergy, and then we would reconcile and verify those.
I have a
if you have any questions, please put them into our chat, and we'd love to answer your questions through our chat. I will stay on the line for another 7 minutes till 3:40 and answer any additional questions that we have. So join me on the chat. Thank you guys for your time. We'll see you guys tomorrow.